Well, I'm Sam Sturrock, an obstetrician, gynaecologist and fertility specialist. I get to work here in Bayside, Melbourne, where I live with my young family and my 2 daughters. I understand what it's like to be busy, to fit that in amongst work and everything else that we're required to do in our life. On the weekends, I love to spend time with my kids, go and watch my 2 girls in their jazz dancing, musical theatre. And I think it's understanding these challenges that helps me relate to my patients. And when they sit across from me, I really understand them, their situation and their journey. I love growing up in Bayside, and it's a real joy to be able to continue my work and continue the legacy of my dad caring for Bayside families. After spending my whole childhood growing up listening to the garage door going up and down at all hours of the night, I certainly knew what I was in for becoming an obstetrician, gynaecologist and fertility specialist. I think it's really special to be able to share this profession and the care that we provide our patients with a fellow fertility specialist as my father. And now, with the ability to look after our patients in a collaborative manner, I think it really provides a nice degree of comfort and continuity to all the women that we look after. I am truly blessed to love my job as much as I do, and probably a little bit too much if you asked my partner and my kids. The most rewarding part of my job is the opportunity that I have to be able to care for patients from the beginning of their fertility journey all the way through to getting to meet their beautiful baby at the end. And the happy families that we get to help create is more than enough reward for that. I treat the first fertility appointment as an opportunity to develop a relationship, understand and investigate any underlying causes that have been contributing to their difficulties, and develop a really tailored and personalised plan that can help each individual or couple achieve their goals. My approach to caring for my patients is pretty simple. I treat everything as a collaboration, and I really feel strongly that they get to know me as a person and I get to know them. That really allows me to understand personally what their goals are and specifically what the challenges have been for them in their journey to parenthood. That allows for us to really tailor our approach to their treatment in an effort to optimising their outcomes and achieving our dreams as quickly as we can. I wish I could say that we did this all ourselves, but in order to provide all of these good outcomes for our patients, it really does require a village. It really is the result of the collaborative effort at Monash IVF that allows us to achieve these great outcomes. Through the latest techniques and technologies, and with the help of our scientists, nurses, genetics staff, this really allows me to provide the most state-of-the-art care for my patients. While it's tremendously rewarding looking after people in some of the greatest moments of their life, certainly through one's fertility journey, there will be challenges. If there's one thing I'd emphasise to couples who are having difficulties conceiving, it will be to come and see us. Earlier review doesn't necessarily mean earlier intervention. Seeing you sooner might allow us to offer lesser interventions to allow you to achieve the family that you desire.